are, as a prominent surgeon, wearing scrubs all the time, going to work. Your fame was when you separated those twins and the surgery that you did. Do you miss wearing the scrubs? Do you miss being in the operating room? How's life today for a lot of people that are listening to you?
Good question. Uh, I I miss the way medicine used to be. I don't miss what it was becoming, and I find that to be the case with many physicians that I talk to. And one of the real goals is to try to make it fun again. I mean, I remember I used to get up and be so excited what we were going to do that day, and that feeling is still there to a degree because you love taking care of people. There's no question about that. And one of the greatest joys of my life now, I operated on nearly 15,000 patients. Almost
Unbelievable.
almost every place I go, I see one of my patients or a member of their family, somebody who knows them, and it's just wonderful. A few weeks ago in Kentucky, a young man that I did a hemispherectomy on 20 years ago, that's where you remove half the brain to stop intractable seizures, had graduated number one in his college class. I mean, it's just
It's a great
amazing.
feeling.
Yeah,
Well, it speaks for who you are and what you've done, and we are all as a surgeons we get a kick out of this. But I feel the same kind of pain that you have mentioned. That over the last decade or so, the distance between the patient and the doctors, and certainly us as surgeons, is going further and further, and the space in between is becoming insurance companies, politicians, attorneys, administrators. Everybody will tell you how to take care of your patients,
all right.
and you don't have the ownership of your patients. Is that how you felt about?
Yeah, exactly. Because what do you need for good health care? You need a patient and you need a healthcare provider. Along came the middleman to try to facilitate the relationship, and now the middleman has become the primary entity dictating to the patient and the healthcare provider what they should do. It's ridiculous.
It's become extremely complicated. And certainly years ago when HMO came in the picture, there was a lot of confusion. HMO kind of went halfway, never made it all the way, but it just made it into a mess where people were going in and out of networks and the complicated health system. But there are a lot of issues with this healthcare system. I don't think it's only just the insurance stuff, but I want to hear your opinion. We have diabetes on the rise. We have obesity on the rise. We talk about metabolic syndrome, high blood pressure, all that stuff that you already know. Billions and billions of dollars are going into managing just obesity and diabetes. So I'm glad that another doctor is running for an office like this, a very important office. And we need more doctors like you to be involved in getting ownership of what's going on in the country. What do you think is going on in this country with all these diseases? How are you going to think about this? And I like the
Sure.
fact that you always use common sense to a lot of these issues.
Yeah. Well, I always say if everybody ate three well-balanced meals a day, drank 6 to 8 glasses of water or water equivalent substances, got regular exercise, regular sleep, and didn't put harmful substances into their bodies, most of us in medicine would be out of a job. But that's not going to happen. So you don't have to worry about that. But I think what we have done is we relaxed in terms of looking at the things that are healthy. Young children, they don't get anywhere near the exercise that they used to get. And that's why we're seeing, the rapid rise of type 2 diabetes in our society. That's horrible. And we're looking at so much more obesity and, hypertension, diabetes, all of those things are related to lifestyle. And unless we begin to emphasize those things, it goes again with some of the relaxation of responsibility in our society.
I feel I agree with you 100%. And I feel that sometimes as physicians, we have gone from being a healthcare provider to like more like disease care providers. We're not really taking care of people's health anymore. We're just, you have diabetes, we're great with amputating legs. You have prostate cancer, we can remove it robotically. But we're not educating our kids to really go back to that age 2 or 3 year old and set a example of not having all of this high salt processed food, etc. So I think education, which is a key word that you've emphasized, is absolutely very credible and important in this.
And it's our own responsibility. I saw a friend yesterday that I hadn't seen for a few years, and I didn't even recognize him. It was only his voice that clued me in. He was weighing close to 400 pounds, and he lost within the last year 178 pounds.
Oh boy.
With just nothing but diet and exercise.
I believe it. All right, before we get into that.